Again, happy day, everyone. Happy Friday. Thank you so much for joining us for this virtual proclamation. Yes, I highly encourage you to turn on your cameras so we can see your beautiful faces. Welcome to today's virtual proclamation signing ceremony for November 10 to November 16 as National Nurse Practitioner Week. So thank you so much for joining us. At this time, I want to recognize the presence of the Honorable Joshua F. Tenori, our Lieutenant Governor of Guam, and also in our Zoom room, Dr. Suzanne Louboutin, Occupational Health Nurse Supervisor at U.S. Naval Hospital, Guam, and one of the newest family nurse practitioners on Guam. Lenny Urbano, Guam Behavioral Health and Wellness Center Nursing Administrator and Psychiatric Nurse Practitioner. Elizabeth D. Santos, Guam Nurses Association and President and Cardiology Nurse Practitioner. Dr. Carla Haddock, GRMC Cardiology and Hospitalist Nurse Practitioner, and also from the Guam Behavioral Health and Wellness Center Psychiatric Nurse Practitioner. Dr. Thora Mark, Department of Public Health and Social Services nurse practitioner and University of Guam nursing adjunct faculty. Dahlia Sapalo, GMH pulmonary nurse practitioner, and Arlie Long, American Association of Nurse Practitioners State Liaison for U.S. Pacific Territories, Kagman Community Health Center Family Director and Family Nurse Practitioner. Hafa ladies, thank you so much for joining us this morning again for November 10 to November 16, 2024 as National Nurse Practitioner Week. I do want to now give the floor to Dr. Carla Haddock for opening remarks. Carla, you have the floor.
Hafa day, everybody, and Viva Nurse Practitioners. I'm so happy to see a bunch of you online, see a lot of familiar faces, see a lot of faces that may have gone off island to get their education and then returned back to Guam to serve our people. We have a great representation of all different types of nurse practitioners. As we know, nurse practitioners serve in a variety of different roles, such as family, psychiatric, acute care, emergency. So we're very happy to have everybody here and supportive, and of course our midwives as well who are here. Thank you very much for being a part of this wonderful community, for showing your support, for your unwavered dedication to serving the island, the people, and for providing consistent quality care. We really do appreciate all of you. And if it was up to me, we'd be celebrating all year long, not just this week. So I'm going to turn it now over to the LT for his remarks.
Thank you, Carla. Thank you, everybody, and happy Friday to all of you. I want to recognize your hard work and determination and commitment, because I realize in order to be qualified to become a nurse practitioner, you have to go beyond. Actually, you have to do a whole bunch of things. While you're already in a profession, you're going to continue on with the education, training, and the cost of that education and training to be able to become a nurse practitioner and to help us respond to the needs of our island. As we know, there is a critical shortage of healthcare professionals on the island, including physicians, and the remarkable progress and expansion of the things that nurse practitioners can do is remarkable. And I know, as I understand from Dr. Haddock, there continue to be needs and reasons why the practice should be expanded, meaning that the kinds of things that nurse practitioners are able to approve and certify to respond to their patients continues to evolve. And I know that our government is going to be a willing partner to help continue to expand and support the profession of nurse practitioners. So congratulations. Thank you. Thank you also to your families. I realize that all the patient care that you're doing and the education you're doing is time away from your families. And for that, I thank you very much for that sacrifice. Viva Nurse Practitioners.
Viva. Thank you so much, Dr. Carla, and thank you so much, LT. I just wanted to note this is our third proclamation for today, but this is the third one that's health related. We started the morning off with Lung Cancer Awareness Month and Smoking Cessation Month, and then after that, hospice care. And so now we're turning over to nurse practitioners and putting focus on the important work that you do. So Cesar Masi. Now I want to give the floor to Dr. Carla for the reading of the proclamation.
This is proclamation number 2024-115, a proclamation of the governor proclaiming November 10th to November 16th, 2024 as National Nurse Practitioner Week. whereas nurse practitioners have served a critical role as trusted healthcare providers for decades, and whereas NPs work to expand healthcare in communities across our island, promote health equity in care, and improve health outcomes for all. And whereas patients depend on the more than 385,000 licensed NPs in the United States to diagnose, manage, and treat their chronic and acute healthcare conditions. And whereas NPs provide high quality primary, acute, and specialty healthcare services while emphasizing healthcare promotion, disease prevention, health education and counseling, partnering with patients to improve their health. And whereas the confidence that patients have in NP-delivered healthcare is evidenced by more than 1 billion visits made annual to NPs across the country. And whereas more than 5 decades of research demonstrate the high quality of care provided by NPs. And whereas better utilization of NPs through modernized state laws and improved policies creates better health through a more accessible, efficient, cost-effective, and higher quality healthcare system. And whereas more than half the nation, including 27 states, the District of Columbia, Guam, and the Northern Mariana Islands, has adopted the full practice authority legislation, offering patients full and direct access to the outstanding care provided by NP. And whereas leading governmental and policy entities, including the National Academy of Medicine, National Council of State Board of Nursing, National Governors Association, and Federal Trade Commission, have taken notice of the benefits of providing patients with full and direct access to the NP-delivered care. And whereas, as we celebrate National Nurse Practitioner Week, we honor the hardworking men and women who work tirelessly to provide the quality of care for all of our island residents so that they may lead fulfilling and healthy lives.
Now, therefore, I, Joshua F. Tenorio, Segundo Magatlahin Guahan, Lieutenant Governor of Guam, together with Lourdes A. Leon Guerrero, Governor of Guam, Magahagan Guahan, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim November 10th to November 16th, 2024 as National Nurse Practitioner Week, given under my hand and the great seal of Guam to be affixed here in the capital city of Hagåtña on this 15th day of November, in the year of our Lord, Anno Domini 2024. And Viva Guam Nurse Practitioner Week.
Yay, Viva.
Viva!
Biba.
Viva, thank you so much, Dr. Carla, for that reading. I'm going to actually go ahead and turn it over now to Dr. Kevin Hitosis. He was struggling to log on, but he was actually the organizer for today's event. So Doc, I want to give you the floor.
Oh, thank you very much. I apologize to everybody for this, but I want to just recognize our colleagues. I want to thank the Honorable Acting Governor Josh Tenorio, and of course our Governor Lou Leon Guerrero for recognizing nurse practitioners' central role in healthcare today, and especially to my colleagues who are dedicated and committed to ensuring that our patients receive accessible and high standard quality of care. Thank you, everybody.
Thank you, Doc. With that, I want to congratulate
Thanks.
you on all the great work you do for the people of Guam. Have a great weekend ahead. Sisus Maasi.
Thank you. This is Maasi.
Thank you.
Thank you.